Great. So thank you so much for being here and being willing to share your experience. Be great to know who you are, what your role is, and I think what the types of roles are of the people that you're offering the training to.
Okay, so hi, I'm Debbie O'Niens and I am the clinical lead for the Integrated Care Board in Cornwall, leading on supported self-management and personalised care and health coaching. I'm actually a nurse by background, so I'm a learning disabilities nurse. So, and my background has very much been around empowerment and, helping people to live their best lives.
And and how are you rolling out the health coaching training locally?
So I came to health coaching about 5 years ago, and with a background in empowerment, I was like, oh wow, this is great. This is an opportunity to shift the conversations that we have with people into a way that makes achieving better health meaningful to people. So I had worked in health promotion and different things and thought, what I'm sharing all this information, why are we not making inroads, why are we not getting better outcomes? And it was just such a light bulb moment, and I realized that all health professionals across all services, people in social care, people in the voluntary sector, anyone who has face-to-face contact with somebody where they may be helping them to support a change which is going to improve their health and well-being, needs to have these skills. So I went big and thought, okay, we're going to upskill the whole workforce. So we have an open rolling program which is open to anyone across who's working across health and care in Cornwall. And that includes care homes, it includes, the voluntary sector, it includes primary care, acute settings. And we really want people to be having conversations which lead to people feeling that they are more confident about their health and well-being, that they feel that they can take back some control about their health and well-being, and that they've really been listened to, and that what matters to them has really been heard. And there's also something around, for me, is bringing back compassion and empathy, and seeing where people are at and what's really getting in the way for them, and so that we can also support them to move through that. So it's been really interesting because sometimes, on the first day of training, you may have some resistance because obviously, many of us, we have our way of working and we have our own dialogue, and I'm kind of asking people to be open to shift themselves. And but by the end of day 2, people are like, oh my God, I completely get it. I had a community matron said to me, I wish I'd had this training 20 years ago. I would not have burnt out, because I've spent my whole career trying to fix people. And now I realize what I needed to be doing was working in partnership with them, and that it's not all my responsibility, that we have a shared responsibility. And also, people start to realize that they've been, if the goal that you're working towards isn't owned by the person, if it's not their goal, if it's not important to them, why would they want to achieve it? That it's and that's a real shift for people. And interestingly, people often on the first day say, oh, I'm a really good listener, that's one of my skills. By the end of day 2, they've often said, I realize I need to listen more.
Yeah. What have you seen people sort of changing the way they practice or the way organizations do things differently?
So we're starting to see that. So we obviously we've really, the whole program has only we've only been training for just over a year, so we've trained 357 people to date, and we now have 2 full-time trainers, so as well as a team of volunteer trainers. And so what we're starting to see, we're training whole teams, so they're then exploring how they can embed that within all of their work. For example, one of the people we trained, Alex, who became a trainer, and she's a physiotherapist, and she went back and fell in love with health coaching, and she has promoted that across her team. All of her team are now trained, and they said that they've embedded the T-Grow model within their conversations, which changes the way that they frame their conversation. And she said it's just become part of everything that she does. And it becomes a much more productive and personal conversation, that it's not just focusing on what the outcomes the organization wants to achieve, it's focusing on what the outcomes the person wants to achieve. And we've recently trained the teams who work with people in drug and alcohol abuse, in homelessness. And again, for many of those teams, they work very much on a rescue model, and which is it's important. There are times when we need to step in and really support people who are feeling out of control. However, you can create such a dependency culture, and so what they recognized is that actually it's when you're trying to move people out of those services that coaching can really help them to build that emotional resilience, and to help them take more control and build their self-efficacy and their confidence, so that they don't keep coming back and you don't end up on that revolving door. And I think the other big change is actually for the staff themselves. So what we've definitely heard is that this improves their emotional resilience, that in stepping out of being a rescuer and becoming an enabler, and feeling and really recognizing the partnership and seeing the worth and the potential of the person that they're supporting, has enabled them to be more resilient in their work.
I think it's amazing. And one of the things that I've appreciated most about you and the work you're doing is that you're actually tackling big issues. You actually, it's not like, oh, we've just got a training event open, come along to the training. It's much more I guess strategic than that. I see you sort of going after homelessness and going after care homes and going, where there are actual blocks and problems in the system. How come? What? Tell me a bit more about that.
I suppose maybe partly because my background's health inequality, supporting people who have massive health inequalities, and so I'm very passionate about we often focus on we're going to do this, we're going to embed this, we're going to deliver this, but we often don't look at the skills, knowledge and competencies needed in order to be able to do that well. And as a learning disabilities nurse, I guess everything I learned was around empowerment. It was about it was relational, it was how you build connection. I work with lots of people who had been in long-term institutions, and what I saw coming into maybe more mainstream healthcare is that we had lost some of that connection. And actually, for groups that are disadvantaged, people who have maybe a history of recurring inequalities and challenges, in order for them to trust us and to want to work with us, we have to build that connection again. And I feel that health coaching does that. It helps to build that rapport, build that connection, kind of brings the love back into the NHS. So it enables a much richer understanding of one another. And I think if we can really understand where somebody is at and what's getting in the way, then we can start to move forward. Yeah. We can't just see, and everyone should be receiving the same standard of care. And often people put labels on, like, you know, complex users, high intensity users, heart sync patients, and actually, you know, all of the people that I've supported who have those labels, that wasn't the situation. These were people who had a history of trauma, who had a history of high levels of sensitivity, neurodiversity, who were trying to make sense of a really complex world and a really complex system, and you know, on top of a history of trauma. And so it wasn't them that was complex, it was what they were facing that was complex. Measuring that impact is a challenge. So I certainly was able to do that with the caseload of people that I was supporting, and had, you know, really good evidence of where people had been having maybe 130 hospital admissions a year and reduced down to 3. People who had reduced, you know, they had been in and out of hospital with falls, and they then, you know, had reduced falls. One lady who actually moved out of continuing healthcare, and you know, so I was able to evidence some of that. But what we very much focused is on the stories, and we actually just set a new target yesterday. We're going to collect 1 story of impact a week, to demonstrate how having these skills, changing your conversation, you know, focusing on what is possible and looking at the potential rather than you know, focusing, as you know, on all of the things that are getting in the way, you know, and it is how that's landing and how that's changing people's lives. So we're sort of very much focused on the narrative. What we're going out to do is we are contacting the managers of everyone that's been on the training, and we are asking them how they're measuring the impact of their service, you know, having these new skills. You know, how are they changing the conversation? How is that having an impact for both the person that they're supporting and also their staff members? So some of that's still in development, but it takes time, and also, you know, every organization may have a slightly different way of measuring that impact. You know, some of the work was done with PAMS. There are new measurement tools out there now, so you know, we're really hoping that people are going to start implementing some of those. We're also working with the Southwest regional team, and we are going to have personalised care awards in the hope that that will also inspire people to share how they're doing this differently.
That's cool. Tell me about that. What's the plan?
So anyone can nominate somebody for the award. It could be a system, it could be a team, it could be an individual, and it has all of the categories of the whole model of personalised care, including obviously health coaching. And what we want to do is inspire. You know, what we don't want to do is we want people to come to health coaching because it's the right thing to do. We don't want to make people do this or force them into it. We want to highlight how transformational it can be, and for everyone, and that and that it, you know, the potential of it to grow and develop. I think a lot of the focus has been on primary care. We want to really highlight how this can benefit the acute sector, how it can benefit secondary care. And, you know, I think that having an awards ceremony and a chance to celebrate, particularly after a time when it's been very challenging in the NHS and social care, may inspire people to start listening to stories of how it could be done differently. And, you know, we're also sort of working with looking at anticipatory care waiting lists, where people may have to manage their health for a long time before they get seen or have surgery. So how can they be optimized in that time? How can they optimize their own health and well-being and stay as well as they can? And health coaching skills can absolutely help with that. and it can also maintain their motivation while they're on that long waiting list. So we have kind of, we're going into lots of areas to look at how conversations happen at the moment, and how it could look if it was done slightly differently.
The approach. I mean, I reckon you guys are going to be, 350 trained. It's amazing. I'm sure you'll double that next year.
So we've set a target for a minimum of 1,000 people trained, and also more than that, what we want is we really want to focus on the impact. So and then building on those skills. So how do we keep developing the skills of those people that have been on the training, who are going back and they are working in a different way, and how do we support them to keep that momentum?
Yeah. And I think that's, it's really great that you're looking after those people as well. If you think about your journey, it's been quite a journey, because we had the whole COVID thing in between. We've had to be, flexible with how it's delivered, all that kind of stuff. If you could, what would your advice be to anyone else looking at setting up internal trainers to actually roll this out? I mean, the reason we want to do it is to make it a sustainable resource for the NHS. I mean, what advice would you offer? What would you share with others?
I think that we've learned lots of lessons. I think the Train the Trainer program is a really great program. I think it brings people together from all across the whole system, so that you have a much wider voice than when you do just maybe employ 2 trainers. I think really looking at the background of the trainers was really important, and why they want to be part of the program. And also, I guess my other advice would be really checking their capacity, and that they're not planning to change jobs, in the immediate future. There are challenges, but that's the same whether people are employed or whether they're voluntarily training. I think for me, the greatest gift was that these are people that come from, all levels, all areas, and that we've come together as a team, all because, and everyone who went through the program was just completely passionate about improving, the conversations that we're having with people and embedding personalized care. And then they take that back, so you're not doing it on your own. When we talk about health coaching, and people, look at what's, lots of reasons where they say, about time, and around, people won't be able to do that, they haven't got the time, or they're too busy. I think what I would say is that, sometimes we have to make a decision just because it's the right thing to do. And why would we not want people to have better outcomes? Why would we not want people to take more responsibility and feel more confident for their health and well-being? And actually, what we should always be aiming for is to do ourselves out of a job. And at a time when services are under such pressure and we have such waiting list, that's absolutely what we should be aiming for, to help people live their best life. And that this is, for me, it's this has such enormous potential to transform the NHS.